All right, welcome back. We're here for another practice question for the Step 2 CK. I am Shelfer, I am Comet. Please like and subscribe. Here we are. All right, go ahead and pause. Answer the question for yourself. We have a 45-year-old male with a history of chronic alcohol abuse and a recent motor vehicle accident who presents to the emergency department with acute onset right-sided chest pain, difficulty breathing. We see that he's hypotensive, heart rate of 120, respiration rate 30 breaths per minute, blood pressure 90/60, oxygen saturation 88%. Physical exam reveals decreased breath sounds on the right and dullness to percussion, and tracheal deviation to the left. Chest x-ray shows opacification of the right hemothorax, accompanied by a midline shift to the left, and it's asking what's the best next step. I hope when you see this trauma and the increased breath sounds and hypotension, I hope you're thinking of a pneumothoraces. The question can be, what is the best next step for someone who has a pneumothorax? And for a pneumothoraces, the answer is almost always putting in a chest tube, or in this case, answer A, an immediate tube thoracostomy. So let's go over why some of the other answer choices are incorrect. So the answer is almost always putting in a chest tube. For this particular pneumothoraces, we're looking at a hemothorax. So hemothorax, you get the rupture and then you get blood that fills into that space and puts pressure on the lung. And so putting in that thoracostomy or chest tube is going to help drain some of that blood off, and that'll help the lung inflate back. So the person had a car accident, blood is now spilling into the pleural space, and we need to drain that off. So we have blood filling up in this space. So that's contrasting it to a pneumothorax. But in both cases, you're putting in a chest tube. The difference is here, taking off blood, here, taking off air. Coming back here, let's go ahead and go over some of the incorrect answer choices. Option B, high flow oxygen therapy. While high flow oxygen therapy may be beneficial to improve oxygenation in patients with respiratory distress, it is not the primary treatment for hemothorax. In a patient with a suspected hemothorax, the main concern is not only oxygenation, but also relieving the pressure in the pleural space caused by accumulation of blood, which is typically achieved by placing a chest tube or a tube thoracostomy. Option C, administration of IV antibiotics. While it can be indicated in treatments of infection, it's not typically the primary treatment of a hemothorax. A hemothorax results from bleeding into the pleural space, and the primary management is to evacuate the accumulation of blood and relieve pressure through tube thoracostomy. Option D, bedside ultrasound of the chest. While bedside ultrasound can be used to assist in the diagnosing and assessing pleural effusions, it's not the definite treatment of a hemothorax. In cases of hemothorax, the most critical initial step is decompression and evacuation of blood, which is typically achieved with tube thoracostomy. And the option E, pulmonary function tests. Pulmonary function tests are not the appropriate initial intervention for suspected hemothorax. These tests are used to assess lung function and may be considered after a patient is stabilized and the underlying condition has been addressed. So you have someone, they're decompensating, they have a pneumothorax, specifically hemothorax, and you want to get that blood off the lung so that way they can breathe and not die on you. So there you have it. Please like and subscribe, comment down below what you'd like to see in the next one, and I'll see you in the next one.